Hello, my name is Eamon Watson. I'm a Business Development Director with EON Reality. EON Reality is recognised as a global player in the provision of enterprise virtual reality and augmented reality solutions to problems that interrupt the success of progress in business. In today's webinar, we're looking at the medical sector, how training and teaching across those sectors particularly lend themselves to an immersive experience that can be proven to increase students' attention and their recall of knowledge. In a moment, I'm going to be joined by two guests to explore this field. Both are experts in the simulated healthcare and training provision sector. After that, we can look at how EON's AVR platform will show you how the anatomy of the human heart works in augmented reality, and you can overlay that to your own field of expertise, and that will no doubt fire your imagination as to how we may be able to help you. Let's move on to that discussion element.
On to the discussion part of today's webinar then, and I'm joined by two guests. Those guests are joining us from the Association for Simulated Practice in Healthcare, and the Chief Executive Officer is Andy Anderson, who will tell us a little bit about what they do in a moment, and a fellow and a member of the Executive Board there as well, Alan Gopal, joins us today. Andy, do you want to start by just briefly telling us about ASPI, its aims and its aspirations for simulated healthcare, and particularly with the move to VR now?
ASPI is a not-for-profit membership association. We've been going for 8 years and have a community of practice across the UK, Ireland, and in some cases internationally. All our members and associates are practitioners of simulation in one sort or another in healthcare across a wide variety of applications. And our aim is to really bring them together and communicate across those networks and across the healthcare network in general to look at new technologies, particularly in relation to improving training, education, and patient safety. And of course, virtual reality is one of those new technologies that we are looking to understand and introduce into the simulated education world.
I may be throwing to you there, Alan. In the current context of where healthcare finds itself, what are some of the biggest opportunities you feel for VR or AR to make an impact, picking up alongside simulated practice?
Well, first and foremost, I think there's a lot of talk about VR it coming into conflict with simulation provision. I actually think that's short-sighted. I think it can complement and augment. We can hybridize the two in particular. And for instance, a part-task trainer, as used by the surgeons, if you add augmented reality to that, or virtual reality, you can create something that immerses the participant in so much more of a powerful way. So in general, I think that VR and AR shouldn't be seen as like a conflicting what's called modality. It should be seen as a complementary modality, and it's a very powerful one. I think.
And if I was to say specifically the biggest example of where, you know, if I was to give you a magic wand and say, take this into healthcare now, and this is where the biggest impact can be made, is there something specific, do you feel, or is it a question of there are a number of similar sized opportunities?
So I've just mentioned the what's called part-task trainers and so on. Another aspect I think we could really focus on is clinical reasoning. So at the moment there's a bit of people aren't quite sure exactly how to teach clinical reasoning, especially in the context of increased safety, reduced clinical exposure with looking at contracts and so on. Now, they're not quite sure how to teach clinical exposure. And one of the ways we could do this is through virtual reality, augmented reality, but actually seeing things that are rarer in front of you, actually what's called through virtual reality, being able to interact with characters that have a particular history and so on, helping the learner to actually navigate, you know, this whole myriad of symptoms and pathology and so on, and understanding exactly what's going on. So later on, if they do come across this rare instance or whatnot, they can actually say, right, actually, I've seen a similar case. I can relate to that. This building up of illness scripts is often used, that particular term. So that's to do with those clinical encounters, and you build up more and more of those. And VR can be used to augment that and help people, help clinicians, recognize things faster, be more certain about things. I think that's actually quite a powerful way we could use VR.
And there are a number of examples where VR, AR are already being used to combat patient anxiety. There's a number of trials there with phobias. What about training costs, though? Alan, maybe, Andy, if I throw back to you on whether it be dental or whether it be medical, and the cost of putting somebody through a very lengthy course. Where do you see that maybe VR, AR, and simulation can knit together to bring down that cost? A, for the student, or B, for the college that's bringing that student, I suppose, to market, if you think of it in an employment sense?
I think there's two ways it can do that. One is with time, so reducing the time to competence, which inevitably has cost benefits, and making the training more effective. So it's almost like a fourth pillar. At the moment, if you're looking at training modalities, you've got online e-learning, you've got simulation in all its forms, hands-on, real-world simulations, and then in the real environment, so watching other people do things to patients. I think virtual reality has it's almost like a fourth pillar of that blended learning. And if we get it right and put it into the right places with the right objectives and the right educational background, then I think it can hugely transform both training and also competency measurement, because as Alan said, you can immerse people in real environments and see how well they perform, as well as how they understand that environment.
And I suppose, of course, you trained as a clinician, you're moving through the medical system. Things are changing all the time and quicker all the time, I presume, like every other industry. So how does somebody who's qualified stay up to speed without disrupting the great demands on their time? I presume equally there's an opportunity there to look at people already within the system.
Yes, indeed, and we do need to be mindful of the fact here that simulation, particularly and very much with VR and AR, it's applicable right across the healthcare spectrum. So we tend to use the word healthcare training and to make sure that all of the potential applications of these technologies are explored, because if we expand it to the widest possible community, that would include patients, and educating patients, I think it's got another massive potential in terms of helping the patient and the medical professional come together and work as a team.
And you're talking about preventative healthcare there?
Preventative and indeed understanding of things like going into hospital or how to manage your own health. Sure.
I know one area that's up for debate massively across the nation at the moment, regardless of technology, is social care, the cost of social care, caring for an aging population. What are your thoughts, gentlemen, on any implications there, and whether it be dementia, there seems a growing issue with that, or indeed care homes and moving people from hospital beds to care homes? Maybe if I just stay with you for a moment on that one, Andy, and ask you about your own thoughts on what is the mood, what's the mood music there, and is there an implication for AR and VR bringing those costs down? Because ultimately it is about cost.
It is about cost, and part of the cost equation, or a major part of the cost equation, is just numbers of people needing to be trained. And that is a key barrier to some of the more complex simulation technologies. They just aren't available in the right numbers to allow trainees to get access. And if you look at social care as an example, the potential training need across the social care spectrum, the numbers of people requiring training and familiarization with how to handle community-based care, the numbers are just prohibitive to do it in any other way really effectively other than a blended learning program, particularly based around VR, because it has the benefit of being able to immerse the person in the real environment without having to be in the real environment. So it's just much more cost efficient.
Alan, obviously you recently trained through as a junior doctor, and simulation will have played its part in that. Can I ask you what you feel about maybe that sector, and obviously with your exposure to it through ASPE, where VR potentially could enhance what's going on and not be seen as a threat? And would the people within that sector as suppliers essentially see it that way, or should they see it that way, do you believe? Is there a fear of the unknown?
I think there's always a fear of the unknown. There's always a resistance to change in the industry and definitely in healthcare. Often clinicians will want to see evidence of like benefit. They want to know that the money they invest has definite outcomes. And I think that is a particular thing that was quite prominent when simulation was first pushed in. I think actually that's going to help VR and AR. Because it is, as Andy said, it's almost like it is a fourth pillar. It is it's experiential learning at its heart, and that's what we know as clinicians is necessary. And,
but when you went through that training, you would have been obviously assessed and accredited on how well you did. And I think you touch on a very, very important point, not just in medical, but in all aspects with VR and AR training moving forward. It's not just about the content mirroring the experience, it's about capturing the data on each individual's movements and maybe enhancing that data with what VR and AR can tell you about what people did, where their eyes were looking, the mistake they made. In a medical instance, why did they effectively not perform that function properly, and putting that into a learning record store. Without that, then it's not really an integrated solution, I would suggest.
That depends on your viewpoint of simulation, whether it should set as a formal or informal assessment, I think, or summative or formative. If you look at it as assessment as, enhancing progress, which is what a lot of simulation goes for, then virtual reality has that ability to add more experience and so on. And you're right, you can actually track it more accurately. You've got a lot more data there than you would have in a normal simulation suite. And that gives you quantifiable variables. And that's quite powerful for a clinician because we're obviously we like numbers quite a lot. So that gives us an idea of exactly where we can enhance our performance. So that's something we could take away straight away before we even start debriefing about what exactly went on. In terms of summative assessment, that's quite an interesting one. And they are starting to pull in more and more simulated assessment. In terms of instances of VR or AR, that would be quite interesting. I think that currently we're at a stage where we're just starting to accept simulation as a form of summative assessment. And I think we need to do a lot more work in terms of VR and AR to be able to actually say with any certainty that if we use it for summative assessment, that we can actually make decisions on it that affect a clinician's career. We need to be sure. But I think with the data, that's going to make it a lot easier. Give a lot more objective view on it.
You mentioned the fourth pillar. A lot of people are saying at the moment it's the fourth coming of VR because EON Reality has been around for 19 years. And, it's really with the advent of the smartphone that mass adoption has arrived. And I think we'll really see where that goes now over the next few years, and it could even become a new computing platform. But maybe going back to you on this one, Andy, that the ability for a smartphone to then use a follow-up for that simulation, whether it be VR, AR, and to take those lessons home and redo them in a mobile environment and practice outside of an expensive setting, an expensive classroom, that is almost a secondary opportunity. So courseware, medical courseware available in VR and AR as a supplement to, rather than a huge textbook which isn't interactive and very, very expensive traditionally.
Yes, and I think the other potential significant advantage of let's call it the smartphone era, is access to high quality training. And there's always been a difference and perhaps a disadvantage for some professions. For example, the training programs for medics like Alan are very different to the training programs for nurses, for example. And allied health professionals now, any profession can have access to very high quality VR-driven training on a smartphone platform. There's no barriers to that now, and we can share experience, what's good experience, what's good training now across any vehicle like a smartphone app. And also, I think the other key thing is to borrow from the aviation world and other high reliability organizations and look at a stepwise training. So if someone cannot do a particular procedure in the right way on a smartphone, there's an argument that says, should they be allowed to go any further until they can? And I think that kind of thinking, it doesn't mean they're incompetent, it just means they need to take a little bit longer to move to the next stage. And aviation has recognised this for many, many years, that it's not a be-all and end-all. You don't do a whole load of training and then pass or fail. It's a stepwise process. And I think that's where VR has huge potential to allow people to experience the real world and then measure how well they got that real world into their personal experience before moving on.
And also potentially, you mentioned that makes me think about the younger age groups and reaching out and recruitment in STEM and the big push to get people involved in sciences, making maybe a slightly easier grade of lesson or quiz or interactivity available around the human body or nursing or the early stages of even dentistry. That could quite easily engage people.
Yes, and I think there is also an increasing interest amongst the healthcare systems in the Western world, for sure, about different training paths down specific skill sets. So instead of you training a doctor or a nurse, you train a particular skill and practitioner to a very high level of competence. Just do that. So if you take, gastroenterology and colonoscopy, that's already started to happen with nurses doing full procedures because they're trained as experts in that one thing. And I think that, again, is where VR could add to simulated practice to fast track that training and help upskill the workforce and allow what you'd call wider top-level experts such as Alan to concentrate on the more difficult arenas.
Alan, if I was to say to you then that with where the market is at the moment, we've simulated healthcare, which has advanced obviously over the last few years. VR and AR as itself as a technology is only a technology. A lot of this is going to be dependent on taking the expert knowledge that already exists and learning from that, learning from those experts and moving it into a VR and AR environment. Do you feel the appetite for those people to get involved and to create that, or even the entrepreneurial spirit, should I say? And is that not a medical thing? Is not a medical mindset and maybe a barrier to delivery?
No, I don't think there's a barrier. I think obviously you've got different clinicians will have different viewpoints and different varying amounts of resistance to new technologies and so on. But you currently have some very switched on clinicians coming through the ranks or consultants now and so on. And they want to use this. They've grown up with this. They see the power of it in their everyday lives, and they want to bring that to the place they work in, the place that they enjoy working in. And no, I think definitely there's a massive appetite amongst clinicians. It's finding the right ones who want to do it in the right way, as well as it's that simple formula of input-output. If we do it right, then we put the right amount of investment and so on, the right amount of expertise and making sure it's designed exactly so it's fit for purpose and so on, and then actually using it in the right way, so getting it out to all the trainees that need it, and actually just seeing exactly what's going on, measuring the outcomes. I think it would be up
to the likes of a company like our own to give those clinicians the toolkit which they could then annotate themselves, enhance themselves, but without asking them to do any technical grunt, for want of a better term, but just to mind dump and brain dump into that arena. So that's where the coalition of interest comes, I suppose.
So functioning as a platform for innovation. So getting those clinicians, you know, the right sort of support would be fantastic.
And understanding the workflow, I suppose in how that's scalable and how you go through those lessons is important as well. It can't be done in isolation as a technical company, or indeed as someone with medical knowledge. Who in ASPE then would you say, Andy, that has recognised this, and are you in a position as a body to deliver that quorum of people to advance this?
Yes, I think we are, because simulation as a relatively new modality of its own, it's not that much younger than VR. In fact, probably about not that much older rather than VR. And experience we've gained about trying to introduce new technologies like this, I think would be extremely helpful to VR. We're only a relatively small association, but we have very good networks. And if you take the key body for the UK at the moment in terms of health education, Health Education England, and they have really moved things forward because they are the first time overarching all healthcare education. So that changes the world significantly in terms of access. I don't think there's any doubt that there is a large number. Our annual conference has become a major event now. It's got 500 delegates.
Why don't you tell us when the next one of those is, so people are aware if they want to get involved in this space?
The next annual conference is in Telford on November the 6th to the 8th. It's a 2.5-day conference bringing together simulation technologies. And we will have, and it did last year, an innovation space which had some VR and AR in it. And I think that whole stream will grow exponentially over the next 2 or 3 years. And certainly we already know that will happen this year. So the latest technologies are coming through thick and fast at the moment, and applications. So part of our role is to try and keep a handle on that. And we work very closely with Health Education England, and I sit on their Horizon Scanning panel, who are looking at a whole range of technologies, and VR is up there as probably their number one at the moment in terms of the potential impact it's going to have. I think the wider Department of Health situation is that, like most public health systems, they're short of money. So I don't think we've got any problem. As Alan said, there are a wealth of experts in the ASPE world, and indeed others that we know,
and internationally with your lookalike organisations abroad.
Exactly. So we're part of the global network, so we know what's happening in other countries. The development of this stuff, I think, is perfectly doable, and people are developing a huge range of different applications. But I think it takes a company the size of yours and other similar companies to be able to move from a research idea into a commercial product that actually can then be supported and rolled out across a large healthcare system. That's not an easy thing, and certainly the NHS is a relatively slow adopter. So you've got to have a infrastructure and a financial stability that allows the technology to be adopted. And the key thing there, going back to your comment earlier, is evidence. It is getting some evidence that this particular technique or technology or training program actually causes a positive outcome, either educationally or patient safety benefits, and that costs money. So I think there is a commercial commercial equation here which needs to be taken into account, but the potential returns and benefits to the healthcare system are huge.
Gentlemen, that has been very informative. Thank you. So just to summarise, I think the key points that I've taken out of that are identify definitive problems that need solving, maybe initially as proof of concept, but obviously that has to scale up and beyond that, and making the content easily available to experts so that they can move their knowledge in without having to get frightened by the technology themselves, and hoovering up that knowledge and working maybe with a body like yours, I don't know, or something similar. And then the key bit beyond that is capturing the data, because without the data, you can't then have those learnings you were just talking about there, Andy. Yeah. Gentlemen, that's been great. Thank you for your time, and we look forward to working with ASPE and making this happen in the UK and elsewhere. Thank you.
Thank you very much.
Thank you.
On to the final section of our webinar today, where we're going to take you through a pre-created lesson of the human heart. This is built in the EON Reality AVR platform, and this can be customized for any part of the anatomy or indeed dentistry or any other part of medical practice. But using the heart, it's a nice, easy way for you to understand some of the functionality that we can bring to experts in their field and allow them to overlay that with their own knowledge. We'll show you in a moment how easy that is to do. So if we start the lesson now, simply by hitting the button on the right-hand side, what you'll see is there is a model of the human heart, and that can be zoomed in or zoomed out accordingly and rotated around so that the student can get a full understanding of the model that he or she is working with and provided to them by the expert in their field. Now, there's an awful lot of different functionality that we can walk through with the heart. Let's show you, for instance, how you might want to see an X-ray view of any particular model. And you can see the translucent form there of the model, and again, get a better understanding. It may be that the student wants to see the component parts that make up the heart. So let's now see the heart split into those component parts by hitting the explode button. And of course, an expert can annotate. He can annotate with video and link into a YouTube seminar he may have done on a particular issue. He can annotate with text, or he can just simply label up some of those different parts of the structure of the heart. When the student sees the plus sign, he knows that additional information is hidden in behind there and can interact accordingly. Now, when the students become familiar with the initial part of the lesson, we can ask them then to assess themselves, so that we now move into the area of accreditation that we were talking to Andy and to Alan about a little bit earlier, and capture those learnings so that we could say to somebody, can you find something? Can you build something? Can you answer the questions to prove that you have the knowledge? So let's go into our quiz mode maybe initially and show you how that would work. Now, the level of the questions and how they can be set is very easy to be input by anyone with PowerPoint skills. You can do that direct from the app, and you'll see in a moment here a question comes up with a multiple choice offering. Now, if the student gets the question right, you'll see in the top right-hand corner of the screen that there's a scoreboard. This can be used for accreditation and put into a learning management system and be used to accredit the student. In this instance, he's got the first question wrong. But if he has a second attempt, you'll see live there that his score has now been registered. And obviously the fact that he got the question as well initially will have been added into the learning record store too. There are, of course, a number of different quizzes. You could be asked to locate a particular part of the body or to identify a part of the body, and those are other opportunities to show you. And if anybody's particularly interested in looking at those, then by all means contact us. We can add in your own models, or of course build from the existing huge library of models that we can provide you already. Now, of course, we don't just want to view lessons in mono mode. These are available at home on the smartphone or any VR AR device, but you may want to see what we can do in augmented reality. So let's maybe look at how we would perform a dissection of the human heart in augmented reality mode. You'll be able in a moment to see that the heart has appeared over the table here. Now, not only can I examine that or indeed perform the previous functionality that you've seen with X-ray or with exploding, but I could also perform a dissection. And you can understand how this is really going to grab the imagination of younger students who have grown up in the digital age and aren't really expecting in-depth textbooks. If you can link this to YouTube and additional information and to manuals or operative instructions, then you can understand how engaging this is going to be. Once we've delivered an AR or a VR project, we can work with any institution to enhance in a fully scalable method a full module that we can then accredit students having passed through in our AR or VR mode. Hopefully you have now understood some of the possibilities of the AVR platform and what that might bring to your particular sector of expertise. We'd love to hear from knowledge experts who we can help to bring that knowledge alive in a virtual reality or augmented reality environment. I hope today's question and answer session was of real value to you in looking at how you can become more involved or solve some of the issues confronting you, and we'd be delighted to hear from you at EON Reality with any questions or issues that are facing you. We'd be delighted to partner with you to solve them. Thank you very much.